talk a lot about hip flexor tightness and how the hip flexors can inhibit range of motion and that are specific to sports or just everyday life, leading into low back pain, hip pain, and even knee pain, or all the way down to the foot. We talked earlier about all the different hip flexors. We have the short hip flexors, which is usually the psoas and iliacus that attach more in our abdominal region or lumbar spine, attaching to the inside of the hip. And then we also have our long hip flexors, like our rectus femoris, that goes from all the way to the patellar tendon and all the way up to the inside of the hip. This is just a little aggressive or a little more aggressive stretch working on the long hip flexors here that you can use with one of these heavy bands. So what you're going to go ahead and do is take one of these heavy bands. You're just going to step in it with one leg. You're going to go ahead and be in a kneeling position. Okay, and you're going to attach this band right underneath the gluteal fold on the upside or up of the hip. And what you're going to be doing is just tightening your abs. You can also tighten your glute on that side and let this band pull your hip forward. That's just going to go ahead and get a little stronger stretch on this rectus femoris. You may get a little stretch here of the psoas as well, but usually for this one you need more extension. Okay, so what you're going to be doing just to get mainly the rectus femoris is tighten that glute, bring your abs down, tighten your abs, or posteriorly tilt your pelvis, and you should feel a very strong stretch in the front of the thigh here. Okay, this test can be used, or this exercise can be used after a test to see if someone's tight. You can do the lean back test. You can also be doing any other test that's going to be looking at hip extension here. Okay, so simply you could just have them bring their leg back here and see if they have improved hip extension afterwards, like I said. Or you can do just the lean back test, see if there's more range of motion in the front of the hip on that left side or the side that you're looking at. So once again, this is just a hip flexor stretch, mainly a long hip flexor stretch with a little increased distraction force here from our heavy band.